Hospital operations shouldn't run on reactive chaos. They should anticipate bottlenecks before they cascade. Our next guest, John D'Alessandro, founder of Amplefi, has spent nearly 2 decades proving this is possible. With over 20 years transforming healthcare operations at systems like Cleveland Clinic, HCA, and Houston Methodist, John brings an unconventional background from automotive manufacturing that revolutionized his approach to patient flow. After facing his own serious diagnosis, he channeled that experience into a mission, helping frontline staff look around corners, spot smoke before fire, and reclaim control over their workday. From predicting ED admissions at triage to relieving radiology bottlenecks in hours, John shares how small signals create massive impact without adding staff or building new space. Join us to discover why John and his team believes we must fix our systems before automating them with AI. Let's go.
Welcome to Passionate Pioneers with Mike Baselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Baselli. I look forward to having you on this journey with us.
Hi, John. A big welcome to our podcast. I'm so excited to have you on today.
I appreciate being here, Mike.
Well, given your extensive experience driving operational excellence across health systems like Cleveland Clinic, HCA, and Houston Methodist, as well as your passion for helping hospital leaders relieve ER overload and improve patient flow by fixing systems rather than simply adding staff or space, I'm excited for this very timely and important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast. You will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers, Mike Baselli, on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn in order to further the conversations occurring on this podcast. All right, John, it's almost time for our community to learn how you and the Amplefi team are pioneering hospital operations management by replacing reactive scrambling with preemptive operations that surface patient flow bottlenecks and put the decisions back in the hands of frontline staff who can act on them. But first, what is that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Well, Mike, my focus is really on hospitals. Healthcare is kind of an ambiguous term. And in hospitals, the key is to embrace the fact that they're complex, adaptive systems. It's like raising a child, not building a car. So in the future, especially with all the technology that's flowing to us, embrace the fact that every hospital, every day is different. It's responding to the context as well as the patients.
How important has it been over the years? John, we'll get into it on the other side of the commercial break. And one thing I'll tease it right now. You founded this company almost 18 years ago. That in and of itself is inspiring. And many of us entrepreneurs that tune in on this podcast want to know how the heck you did that. But we'll get to that after the commercial break. But John, has that been something that has been a guiding principle for you all these years in regards to making sure that we embrace that uniqueness, understanding where these customers, where these health systems are coming from? Is that something that has been part of the ethos, part of the culture to Amplefi all these years?
It absolutely is. My background is really manufacturing systems. I'm into this mess really 20 years ago before I even started Amplefi. And, I heard best practice. And I heard Lean, Six Sigma, and all these things, very familiar to a manufacturing engineer. But you know what? That isn't a factory. That's a hospital. And because of that, it was easy to be, not easy, but I had a nice opportunity to be able to deliver unexpected benefits, things that seemed like they were worth $1 million that we invented on Monday and implemented on Friday. There's just a lot of squeeze in the tomato that we seem to be walking past.
So,
And, maybe some people in your audience would be thinking, wow, come on. Think about it. In 2020, we learned that the smartest people in the country thought the issue was we needed more ventilators and we needed big white boats to show up in our cities to take care of all the patients. And you know what? They never used it. That wasn't the problem. In fact, I actually published a paper on now that we have GM making 40,000 ventilators, who's going to staff them? That is the issue. The issue is we have an industry here, hospitals that are quasi-regulated. It's sort of very homogeneous. Every hospital feels like the same thing, but it's not. The context, the environment, the docs, the nurses, the family, the insurance they have, these are all factors in what happens to you in there. So don't listen to the crowd. We wouldn't have had the housing crisis. We wouldn't have had idle capacity if people embrace the fact that every hospital is different.
well, John, it's a good guiding principle and really is going to set the stage for a very important and exciting conversation we're about to have on the other side of this commercial break. Because as well as I do, health and care is still delivered in our communities across this nation. And last time I checked, our communities are very diverse across the land. And so love that guiding principle. Great way to anchor us for a very important conversation. We're going to unpack so much more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we're back with John D'Alessandro, founder of Amplefi. John, almost 18 years in on this journey with Amplefi. There's going to be a lot to talk about just in that alone. Pushing 2 decades in founding your organization. That is a major celebration, major milestones, of course. Can't wait to discuss the journey of how all this came to be in the first place. What were those aha moments? How did Amplefi come into focus? You teased it on the front end a bit, talking about being a systems engineer. Can't wait to really understand how this story even began. Then, of course, we got to discuss, hey, who is Amplefi today? What are you guys working on today, especially in this very fast-moving space that we're all experiencing in healthcare, whether it be from the disruption side of artificial intelligence, technology, or otherwise, or just where we are at the current state of our healthcare system and where your organization is and where things are heading tomorrow. What are you seeing kind of from that watchtower, from that perspective that you have as one of our leaders in the industry? Where are things heading for the industry that you are seeing? And of course, where is Amplefi going to be over those next number of years? And of course, John, we can't get you out of here until we figure out a way to help you and the team out with our amazing community that's rallied around this podcast. But first, John, I'm going to ask a lot of you. I'm going to ask you to rewind the clock maybe 20 plus years ago. Give us a little bit of a teaser behind the scenes, if you will. How did this company come into focus in the first place? How did you find yourself in healthcare? Where were those aha moments? Let's talk about how you even had that audacity to found a company now called Amplefi. How'd that all come to be in the first place?
Well, if you look back 20 years ago and watch the Super Bowl, you would have seen it was the .com Super Bowl. Every ad was .com. And my buddy, who's a double board certified trauma ED doc, and I were sitting watching the Super Bowl, and he said, we should .com the hospital. So I as a manufacturing engineer for General Motors, working on just-in-time inventory systems, which meant that I spent my day reducing inventory. Not very inspiring. I mean, good business, but not what you wanted to do with your life. Anyway, I walked around that hospital and I saw patients stacked up. I saw the doc. I saw my friend call the CFO and ask him if he could go on diversion. And they said, no, you can't. Well, I got strokes coming in. I got this coming in. They're stacked up. Tell them to admit them. It was deaf ears. And when I spent some time walking around the halls and you go up and the ICU nurses and the ER nurses were fighting each other. They both thought they were too lazy. There was cultural problems. But you know what, Mike? When you see a fire, there was probably smoke before we got there. And what were the signs that this was going to happen? And it turns out that it's very easy to spend time with the frontline staff where the real knowledge about how things are going, and they'll tell you, like a triage. Here's an example. I have a triage nurse. So I sat with her and I said, can you predict how many people are going to be admitted at triage? And she said, I don't know, let's try it. So over the course of a couple of days, we found out that she's about 80% accurate on the triage. Well, let's think about that for a minute. That is smoke. That is a signal that there is a problem brewing. If you just admitted or you just triaged a bunch of shorter breaths who are probably going to spend a couple of days in a hospital with congestive heart failure. So if you could give that insight into the house supervisor, bed control people who are allocating the beds, and say, in 4 hours, 4 hours is what it took to get through that ED. In 4 hours, you're going to get 4 people looking for a bed. Now, that's like an aircraft flying in the sky. It's coming down. It can either come down with you ready for it, or it could come down and crash. And if you wait, if you blow those 4 hours, you're going to have people on ventilators sitting in the hallway waiting for a bed. So what if we just let people know that we're going to have a bad afternoon at 2:00 in the afternoon instead of at 6:30 when everybody's jammed? Imagine the impact. And let me tell you, you know how much that solution cost? 10 cents. That's a text. And that is the power of this. We have to give people the ability to look around corners. And once they do, they know what to do. If you know what to do when you smell smoke, then the biggest problems, Mike, they don't start big. What happens is they start small and we ignore them, and then they get big.
A good way to frame this up, John, in regards to when you first started, you mentioned the Super Bowl 20 years ago, the .com, all the commercials. I remember that distinctly as well. But John, if we take that back then and you had these ideas and you brought it to healthcare system leaders, what was happening at that time? What was the status quo? What was happening at the time? What were they doing? Did they look at you as deer in headlights? Like, what are you talking about, John? This is, you're coming from another planet. How are your ideas and your thesis received at those times? Obviously, you've been successful now leading the organization for almost 20 years, but in those kind of founding moments, what was the reception like when you had these ideas and you're bringing them to market?
Well, I'd invite your audience to Google iconoclast, because nobody wanted to hear from me. Nobody believed me, and they fought me. I had CFOs telling me, well, I don't want ED admissions. Okay. So we're not going to do this project because I don't want ED emissions. That sounds good. So what are you going to do? And, well, we got a Six Sigma program here. All right. And then, oh, okay. Well, sounds good. What can I say? So I got thrown out of a lot of offices. I had a lot of CFOs tell me, I can't afford to believe you because you're walking in the door and telling me that you're going to give me 20 admissions that I don't get now. And John, those are $20,000 checks. I can't look at my boss and hear that some pump with a manufacturing engineering degree is telling me how to run my hospital.
John, well, thank you for that context. Yes, it's a good thing to look up iconoclast. That is a very important term, especially in healthcare, not only today, but even yesterday when you were still trying to build this company, getting thrown out of offices by those CFOs. But obviously, along the way, John, somewhere the tide changed for you. And you had that opportunity to continue to build the organization now, like I said, almost 20 years in. So obviously, you started getting some yeses somewhere. Can you share with the community, where did that tide change? Where were you getting those yeses? Where were you finding those opportunities to really start getting the organization going and not getting thrown out of those rooms with the CFO, et cetera? What were some of those moments that you started seeing the tide changing?
Well, one of the biggest ones was a hospital in McAllen, Texas. They were dealing with severe overcrowding. They were looking for capital to build new wing, and they needed to put some points on the board with corporate to make sure that they understood that the potential for ROI was there. So everybody around the table was sort of invested in seeing if this kid from Ohio could really turn the worm. And basically, we went in and did what I just sort of alluded to in the opening. We started looking for the signals that if we could address earlier, it would make all the difference. And one of those signals was looking at radiology as an example. In almost every hospital, at least that time, radiology was absolutely tied to the emergency department. Everything was stat. So somebody comes with a broken thumb, stat x-ray. Well, it turns out that up in the house, there were people waiting to go home, but they were waiting for an x-ray. They had pneumonia, and they needed an x-ray clear before they could go. Well, bed was being occupied by somebody who was waiting for a broken thumb to get x-rayed. So we did something crazy. We said, here's a list of the people who are likely to go home today. If any one of these people are ready to go, do them first. Tell the ER that we'll do the stat x-ray after we handle these. All I can tell you is the CEO at that time said to me, what you've done here is a miracle. Because what happens? They had a 5-to-1 ER visit to admit ratio. We take out 2 people who are waiting for x-rays, and you get 10 patients through the goose. Wow. And once that happened, we caught fire. He told all his friends, you need to talk to this guy. And that was it.
So that springboards us into today, John. Let's talk a little bit about, obviously, been a long story journey. What is happening today? Obviously, things are changing rapidly for all of us in this healthcare industry. The pace of change is just getting faster and faster, not only in our personal lives outside of our work, but of course, within the healthcare industry as well. Who is Amplefi today, John? Can you describe what is going on today in the organization and what problems are you really help solving with this very fast motion that we're starting to all experience in the industry? Who is Amplefi today?
Amplefi today is really more of a front staff, frontline worker, coach, mentor. What we're seeing is that this overwhelmed feeling that you keep hearing about, we were short of staff 20 years ago. we're still short staffed. But the difference now is we have burdened our frontline staff with so much cognitive load that it's no doubt that they're overwhelmed. It used to be pretty simple. Doctor rounds, you talk to the doc. Now everybody's looking at glass all day. They're not talking anymore. And what they're doing is they're reacting to alerts and alarms and, medication alerts. I've been in hospitals where the override on medication alerts is 90%. That's like a car alarm. When's the last time you called the cops because a car alarm went off? That's what's going on here. We are burying these people in things to consider. And then we give them logs and we start putting them into process improvement exercise. What's going to change in the process? Nothing. All you're going to do is study. So we have people who are just done. They're cynical. They're tired. They just can't do it anymore. So we've created offerings to help them drive their own improvement initiatives. Do it at the frontline staff. And if you really think about it, you want a critical mass of people that don't need change management or all kinds of consulting help. Just give them a way to look around the corner. Sit down with them and think about the protocols and what you should do when you see and smell the smoke. And then have the courage to act. That's all you need. So that's what we do now.
Well, let's talk about that. It's an important topic because it is obviously top of mind to everybody in the industry right now, that frontline staff. Let's talk about how you guys are also going about it kind of tactically. Obviously Amplefi puts decisions, quote, in the hands of the people on the floor who can act on them, end quote. And in a traditionally hierarchical healthcare environment that we're plagued with all over this country, how do you and the team empower frontline staff to make these calls, and what resistance have you encountered from middle or upper management along the way?
Well, upper management is also overwhelmed. We're beating up these people, and we need to stop doing that. But in reality, I think that a lot of the executives we're meeting are sort of locked in I've got to do something. And their overwhelming feeling can be overcome by telling them to just let it go. Quit trying to process improvement your way through it. You don't need process improvement. You need a way to look around the corners. And if you let the frontline staff do it, there's a cultural win that comes with that. People like to win, and they like to be part of the solution. So another crazy example, we had a nursing unit in a children's hospital that was constantly late on putting aspirin on their kiddos because the pharmacy had to dilute it, put it in a syringe for them. And it only had a 15-minute shelf life. So the pharmacy's running around like crazy trying to get them their doses. So somebody says, why don't we mix it up in the unit? Just give us the powder. How hard is it? I do it at home all the time. And then I had to say out loud, you thought enough about this woman to let her administer vancomycin or vincristine. Why don't you let her put aspirin on board? And guess what? The number one complaint of the pharmacy goes away overnight. And that's the kind of thing that if a leader just lets that happen, who knows what they'll get.
Absolutely. What a great example of how to bring all that to life. Now, John, of course, we got to discuss a little bit of future state. Obviously, again, keep hammering on it, but things are changing rapidly and will continue to do so. And these next 2 to 3 to 5 years are going to be a lot more of this change environment that we're all experiencing. John, what do you see on the horizon, not just for the industry, but from your kind of perspective as a leader in the industry, not only for the industry on the macro, but what else are you seeing for Amplefi? Where do you see things heading over the next number of years?
Well, Mike, I think you might want to Google AI because that is what everyone seems to be talking about. But here's the problem. I use AI in my technology business. And let me tell you, AI makes things go really fast. And it also gives you lots of bugs. So you're going faster, but you're working on different things. And when it comes to healthcare, we aren't imagining how we're going to change the way we work. What we're doing is we're looking at AI and saying, well, how could this improve this process? That's the wrong question. The right question is, why are we doing this? Why are we trying to put another smart person in a process that's fundamentally broken? And that smart person is Claude or ChatGPT. All we have here is somebody with a great memory and the ability to make a decision very quickly. But if you haven't fundamentally thought about why are we doing the things we're doing, you're going to just make the problems you have a lot worse. And that is the biggest challenge that I see is the hype. There is so much money going into AI. Of course, those investors are going to say, we need to do whatever we can to get in the middle of all this. But I think the amount of money that could potentially flow out of investors' wallets into hospitals to get no impact or actually, hold your breath, worse is quite high. And I think we need to really rethink our management systems first before we start spending a whole lot of money trying to automate something with AI. Just take the driving. You know, in 2016, we heard that cars are going to drive themselves. I mean, that was going to happen. Elon Musk. And then we heard that AI is going to end radiology. You know, it's going to diagnose whatever. And then the next thing I see is radiologists sitting in their cars in traffic jams because they're on their way to work. But nevertheless, you can't automate something that's broken and expect it to get better. Automation makes the problems go faster.
Very good perspective, John. Really appreciate that. Now, of course, before we let you out of here, we also need to talk about how we can be helping you. What's one problem, need, or question that you and your team have that we can be helping you with?
Well, I think that the key question that I have is how can we systemically expose the frontline staff to a way of reducing the load that's on them? It's a matter of, you know, at 3:00 in the morning, an ICU nurse becomes a genius because nobody wants to talk to her. We need to find a way to equip that person with protocols for what to do when they feel smoke. And then we need to make sure that leadership fosters a culture that doesn't punish people for taking action.
Well, in order for our community to have those conversations with you, to continue to really think hard about that, there's some really good issues that we definitely need to continue to keep top of mind. How do they get a hold of you, John? Social media handles, websites, or otherwise, how do they get a hold of you?
Well, an easy way is LinkedIn, Jay D'Alessandro. Also, Jay D'Alessandro at john.d'alessandro.com is my new email address. You can also get me at jdalessandro@amplefi.com. But no matter what, we're monitoring our signals for sure.
Excellent. For our listening community, feel free to head on into the episode notes where you're accessing this podcast. Those contact points for John and his team will be in there. Of course, you can head over to our free global online community as well over at passionatepioneers.com, where there will be a post for this episode, and you can leave any comments, suggestions, feedback, or otherwise, and grab all those contact points online. Again, over at passionatepioneers.com. John, before we get you out of here, we do have a fill in the blank for an opportunity to really wrap up all of the conversation we had today. I'm a passionate pioneer because?
I'm a passionate pioneer because I need healthcare to work.
Absolutely. Don't we all? And what a way to wrap up this important conversation. Couldn't be more true now for all of us. So thank you so much, John. I appreciate you taking time to be with our community today and share with us where Amplefi has been and, of course, where you are going as well as we continue to work together to move the industry forward. But for now, John, thank you so much for being with us today.
Thanks, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Baselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Baselli. I look forward to having you back with us during our next episode.